Hello everyone, my name is Premana Naidu. I'm from Jurutobang 21, and in this video we're going to be talking about an issue that's been plaguing Malaysia recently, which is the shortage of surgeons and the lack of surgical equipment in our healthcare system. This problem not only affects the numbers on paper, but it also affects real people and their access to medical care every day. Let's start by looking at the bigger picture. Malaysia's healthcare system has been making significant strides over the years, but it's also facing some major challenges. As our population grows older and non-communicable diseases like diabetes and heart disease become more common, the demand for surgical procedures is increasing. But here's the problem. The number of surgeons hasn't kept up with this growing demand, especially in rural and underserved areas. In some parts of the country, finding a specialist surgeon can be incredibly difficult, if not impossible. This lack of surgeons isn't just about numbers, it's about access to life-saving care. Imagine living in a remote area where the nearest hospital with a qualified surgeon is hours away. In an emergency, that distance can mean the difference between life and death. Even in more urban areas, the demand for surgical services can lead to long waiting times, which can delay critical treatments and lead to negative outcomes.
Okay, hi, my name is Rikesh. So today we're moving into the topic which is lack of surgeons and lack of surgical equipment in our country, Malaysia. So I'm going to be talking about like how this issue is happening and the factors. But before that, let me just move into this. This is actually a very critical issue for our country, as it's not only a medical issue, it has become a big public health issue as well, as these are affecting our patients from across the country, not only like certain areas, but the whole country across. And this is actually a very serious topic, as because World Health Organization has put that for every 100,000 people there must be a certain amount of surgeons, but our country, they're only producing 10 surgeons for every 100,000 people. So this is actually a very serious topic, as it is very much below the requirement rate from WHO. Factors contributing to the shortage of surgeons in Malaysia. Firstly is the educational and training bottlenecks. One of the primary factors is the limited number of medical schools and specialized surgical training programs. Although Malaysia has made strides in expanding medical education, the number of graduates who go on specialize in surgery is still low. This is partly due to the rigorous and lengthy training process, which can take up to 10 years, including undergraduate studies, medical school, and specialized surgical training. Next is brain drain. Another significant factor is the migration of skilled surgeons to other countries in search of better opportunities. Countries like Singapore, Australia, and United States offer higher salaries, better working conditions, and more advanced facilities, which attract Malaysian surgeons abroad. This brain drain leaves the local healthcare system struggling to meet the demands of surgical services. Lack of surgeons and lack of surgical equipment here in Malaysian hospitals. The first part is everyone knows is budget constraint. Malaysia is a developing country, so there's not enough budget for everything. So there is always a limited budget on the healthcare system, and especially on government funding healthcare systems. So like in certain private hospitals, they would have the equipment to handle this kind of procedures. However, in like rural areas such as government hospitals, they wouldn't even have a simple technology such as laparoscopy or even a functioning operation theatre to even handle this kind of issues. The final factors for contributing to the lack of surgical apparatus is the supply chain challenges. Malaysia also faces challenges in procurement and distribution of medical equipment. The country relies heavily on imports for advanced surgical tools, which can be affected by global supply chain disruptions, fluctuating currency exchange rates, and bureaucratic procurement processes. These issues can lead to delays in acquiring necessary apparatus, further hindering the capacity to perform surgeries. In conclusion, the shortage of surgeons and surgical apparatus in Malaysia is a multifaceted issue that requires urgent attention. By tackling these issues head-on, Malaysia can work towards a more equitable and effective healthcare system, ensuring that every citizen has access to a surgical care they need.
There are a few solutions that the Malaysian government has implemented to increase the surgical equipment and also surgeons in Malaysia. According to the NIMP 2030 sectoral plan, the Malaysian government has said that there will be an increase of orthopedic and dental equipments by the year 2030, which will allow the increase of orthopedic and dental surgeries in Malaysia, and also allows for precision and proper surgeries as well. Robotic surgeries is also popular in Malaysia as well. Sunway Medical Centre and UITM Private Healthcare has decided to implement the Da Vinci Robotic Assist System, which will allow for surgeries such as urology, gynecology, general surgery, and also pediatric surgery. By implementing the surgical robot Da Vinci, this will allow for short stays in the hospital, less pain, and also decreases the burden of the surgeons. Decreases the burdens of the surgeon to conduct the surgery properly. To increase surgeons in Malaysia, one of the plans that the Malaysian government has decided to take is to align the cardiothoracic pathway training program with the UK intercollegiate surgical curriculum, as this will allow future or upcoming cardiothoracic surgeons to learn more about cardiothoracic surgeries properly and easily as well. And that's all. According to the NIMP 2030 sectoral plan, the Malaysian government has said that there will be an increase of orthopedic and dental equipments by the year 2030, which will allow the increase of orthopedic and dental surgeries in Malaysia, and also allows for precision and proper surgeries as well. Robotic surgeries is also popular in Malaysia as well. Sunway Medical Centre and UITM Private Healthcare has decided to implement the Da Vinci robotic assist system, which will allow for surgeries such as urology, gynecology, general surgery, and also pediatric surgery. By implementing the surgical robot Da Vinci, this will allow for short stays in the hospital, less pain, and also decreases the burden of the surgeons. Decreases the burdens of the surgeon to conduct the surgery properly.
Hello, I'm Rafael Lutz, and today we'll be exploring some of the real-world examples of the surgeon and medical equipment shortages in Malaysia. Starting off with a bold statement, did you know that in the Sultan Idris Shah Serdang Hospital in Selangor, there are an estimated 1,000 patients waiting in line for urgent life-threatening surgery? Not only that, at Penang General Hospital, the waiting list for that same surgery is skyrocketed to an estimated 850 people, while the waiting time at the Kuching General Hospital is more than a year. Currently, there are only a mere 14 cardiothoracic surgeons serving in the 7 public hospitals in Malaysia where that surgery is performed. Not to mention that these surgeons are also overworked and they have to attend to emergency cases beyond their working hours.
Expanding on the current situation, it is clear that the shortage of cardiothoracic surgeons in Malaysia is reaching a critical level, significantly impacting the quality of care patients receive. The shortage has led to increased waiting time for surgeries, with some patients waiting for over a year to receive life-saving procedures. This delay is not just a matter of inconvenience. For those with severe heart conditions, every day without surgery is a day their condition could deteriorate further. The emotional and physical toll on patients and their families cannot be overstated, as they navigate a healthcare system that is struggling to meet the demand for specialized surgical care. Moreover, the shortage is not just limited to surgeons. It extends to medical equipment that is essential to hospitals. In this situation, hospitals are often forced to make difficult decisions about resource allocation, prioritizing certain cases over others due to the limited availability of surgical instruments, operating theatres, and even basic medical supplies. This scarcity further complicates the problem, as even when surgeons are available, they may not be able to perform surgeries due to a lack of necessary tools. The combination of overworked medical staff and insufficient resources creates a vicious cycle where the quality care continues to decline and the patient outcomes suffer as a result. Addressing the shortage of medical equipment requires a multifaceted approach. Investment in healthcare infrastructure is crucial, including the purchase of new equipment and the maintenance of existing tools to ensure they remain functional. Additionally, there needs to be a focus on equitable distribution of resources so that all hospitals, regardless of their location, have access to all the tools they need to provide high-quality care. Partnerships with private sector companies and international organizations could also be explored to secure donation and discounted rates on essential equipment. Ultimately, ensuring that Malaysian hospitals are well equipped is vital for improving patient outcomes and maintaining the overall health of the population.
Hello everyone, a very good day. So I am Loshna from Juruterbang 21 and today we're going to talk about the lack of surgeons and the lack of surgical equipments. Okay, so the lack of surgical equipments and surgeons plays a significant role in today's issue as it creates a threat and also poses a very big challenge that is faced by most people in the public health. So to conclude it all, more solutions and the public society should pay more focus on solutions and also ways to overcome such problem in order to provide a better healthcare facilities and to also provide a better and efficient healthcare system for the public society in order to improve their healthcare.